Hi everyone, welcome to Baby Care Saturdays by Rose Walk Luxury Hospital for Women. And today I am with Dr. R.G. Holla, Senior Consultant Pediatrician from Rose Walk Luxury Hospital for Women. Hi, sir.
Hi, Mahima. It's such a pleasure to be here, and it's a real privilege for me to have this opportunity to speak to all of you.
So thank you so much, sir. We are really excited to get started with this baby care Saturdays because we feel that a lot of mothers at home need that extended support, guidance, and care to let them know about what is right for the baby and what is not right for the baby.
Yes, absolutely. And I think now with the changing weather and also the circumstances that we are seeing all over the world as well as in North India, I think a lot of mothers have so many questions regarding the kind of care that they need to do for their babies.
Right. So our today's topic is on how to take care of your baby during this winter time, which I think a lot of mothers are totally going to love watching this video today.
Yes, that's right. Winter is quite a challenge. In fact, in North India, with the coming of winter, there is a lot of climatic change that happens. Temperatures drop, but at the same time, humidity also tends to drop. The air becomes very dry, and sometimes caring for a baby becomes quite a challenge. A very common question asked by parents is, what is the ideal temperature in which we should keep our newborn baby? Now, when babies get discharged from the hospital and when they go home, this is a common question. So what I always tell them is, there is no ideal temperatures. The baby can be brought up in any type of a temperature. It's the appropriate clothing and the appropriate care that's important. So if we talk about temperature, then what we should do is try to keep the room at a temperature at which we would be comfortable wearing one or two layers. And whatever number of layers an adult is wearing, the baby generally needs one layer in addition to that. A common mistake that happens is that parents tend to warm the room. They tend to bundle up the baby in heavy clothing and then heavy blankets, and that can sometimes not only make the baby very uncomfortable, but can also overheat the baby. So it's always wise when you're choosing clothes for your baby that you should use layers, using thin cotton layers, multiple layers that traps the heat, and it provides warmth to the baby, and at the same time it allows the skin to breathe. So that is one thing about the temperature. As winter becomes colder and colder, there is a tendency to use heaters in the room. Now, please remember that when you use a heater, you have to appropriately take off the baby's extra layers to make sure that the baby doesn't get heated, overheated. The other thing that happens is to do with humidity. As the wind becomes colder and colder, the humidity level decreases. So that leads to a lot of dryness. It causes dryness of the nostrils, it causes dryness of the respiratory passages, it causes dryness of the skin. We feel it ourselves. But in babies, it's a special challenge because their skin is very immature, their respiratory passages are very immature. So in a situation like this, babies often become uncomfortable. They start having nose blocks, they start coughing. And one easy way of dealing with this is to increase the humidity.
So having a humidifier would be a good idea?
Having a humidifier, keeping in view the fact that a humidifier the water should regularly be changed, very clean water should be used. So keeping a humidifier, using saline nasal drops, these are all ways to mitigate the problems related with dryness.
And especially with winter-born babies, I would say babies are going to be born in winters, and mothers who are packing up the stuff, especially the clothing that they're going to decide to put onto a newborn baby in winters. Any special extra care for mothers for a newborn baby in terms of the clothing layers or the fabric that they're choosing while buying winter clothes for the baby?
Yes. Baby skin is very sensitive, and we should try as far as possible to keep the baby skin in contact only with cotton. So the innermost layer should be a cotton layer. On top of that, rather than putting a very heavy jacket or a heavy sweater, it would be always better to use multiple layers. So if a baby is wearing, let's say, a vest, followed by a t-shirt, followed by maybe a light woolen sweater, that would be all right for the upper part of the body. The lower part also should be covered with a pajama. And the head is a place where babies tend to lose a lot of heat. So a soft cotton cap, which is firmly fitting, but at the same time it's not too tight, would make the baby comfortable. Uh, in addition to that, we always recommend for babies, mothers should keep feeling their hands and feet. If the hands and feet are feeling cold, then the mother could put a pair of socks or gloves or mittens on the baby. One very good way of warming a baby is through body heat. So there is something known as candle, in which the mother reclines either on the bed or on a chair and holds the baby against her body. And if she can do skin to skin contact, that's not only very comforting for the baby, it also provides warmth and it has lots of other benefits.
And it helps for breastfeeding also.
Absolutely, it does. Yes.
Great, sir. So, and let's talk about a little older children. Now, any extra care in this typical weather of, I would say, Delhi, where there's a little bit of smog also, there's winter time also, and COVID times as well. So, any higher risk of respiratory infections in children during this time?
Absolutely. Winter is a time for respiratory infections, and respiratory infections are caused not only by COVID but also lots of other viruses which come. And because the rooms are not very ventilated, we usually end up closing all the windows and doors. So there is actually a magnification of the viral load that happens inside the room. And so viral infections are very common. Viral infections lead to running nose, blocked nose, cough, breathing difficulties, which are again aggravated by the dryness in the air. So again, the use of a humidifier, use of nasal drops, and of course monitoring a baby very closely, because many of these babies in winter end up developing chest infections, and those chest infections can suddenly become dangerous. So that's about the infections. In addition to that, we have the unique challenge of being the most polluted city, and during winter the pollution just adds an extra level of danger to a child who's already sick. The outside air is very polluted, but please remember that indoor pollutants can also be very dangerous for the baby. So there is PM 2.5, which can enter into the deepest part of your rooms. In addition to that, there are certain indoor pollutants like mold, like fungus, like dust which comes from mattresses and pillows, carpets. All these things can aggravate the child's condition. And in addition to that, if somebody is smoking tobacco, that is a very, very, very big poison. And I would very firmly say that please, please, please don't do that. Now, coming back to your original question about how to warm a baby who is older, yes, again, the same principle should be followed. That is, that we should try and put as many layers on the baby. Rather than putting heavy sweaters and jackets, put multiple layers, keep the baby in a set of clothing in which he's comfortable, he's able to move around, but at the same time he's able to be warm without getting chilled.
Right. And so a lot of times, parents typically think that if it's winter time, exposure to sunlight is very good for the baby. Now, how much exposure of sunlight is good, and what should be the right way of exposing the baby to the sunlight?
Yeah, so sunlight definitely has a lot of benefits. Unfortunately, the North India winters tend to be a little smoggy, and because of that, the sunlight is very weak. One should make sure that while exposing a baby to the sunlight, you're exposing your baby to other elements like wind. Your baby could get chilled, or if you leave your baby out in the sun for a long time, the baby could become overheated. So you need to be careful. I would say that a good duration of time to expose your baby is about 20 minutes. The baby should be in a sheltered area where there is no direct wind. It is always better to expose the baby directly to the sun rather than expose the baby through a glass, because the glass filters out a lot of good beneficial waves which help in the making of vitamin D. So when we expose the baby about 10 o'clock, 11 o'clock is a good time for about 20 minutes, keeping a very close watch or observation on the baby to see that the baby doesn't get either overheated or overchilled.
And what should be the right clothing at that time when the baby is being exposed to sunlight?
So the clothing should be definitely the face should be kept in the shade. Direct exposure to the sunlight may hurt the baby's eyes. The rest of the body should be appropriate to the temperature outside. I would say a thin layer of clothing which can be removed for a short duration and then the baby can be put back into those clothing. That would be the idea.
Great, sir. And any extra care during the COVID times, because again, there's a peak in the number of active cases happening in Delhi. So, any extra care that parents must follow for their little ones?
So, COVID, as we all know, is spread through droplets, through aerosol, and through contact. So, it's very important that the baby should be protected from all these three things. There should be a minimum number of people who should be handling the baby. Maybe the baby's parents, maybe a grandparent, and one should avoid too much contact with people who are coming from outside. Those who do come from outside, if they have to touch the baby, first of all, they should be permitted only if they are not having any fever, cough, cold, running nose, and so on. Before touching the baby, hands should be properly sanitized. They should be wearing a mask. And strictly no kissing the baby because it is through the mouth and through the nose that the infection passes on. So once, if you're careful about those things, generally it can keep your baby safe. Once a baby is infected, if a baby has got some symptoms, then it's very important to keep a very close monitoring and a very close watch on the baby's condition and to look for danger signs.
Any specific danger signs that parents should look out for?
Yeah, if the baby is running high fever, if the baby is not able to breathe comfortably, a baby is panting or is gasping, a baby has persistent refusal to feed, or if a baby is extremely lethargic, those would be signs where I would advise parents to take the baby to the hospital and show it to the doctor immediately.
Great. So those were some great tips by Dr. R.G. Holla, Senior Consultant Pediatrics at Rosewalk, and who's also available for consultation at Rosewalk. So in case you want to find out more or get a nice pediatric consultation, Dr. Holla is available at Rosewalk Luxury Hospital for Women in New Delhi. We'll be happy to take questions from the audience now. So in case there are any questions, please feel free to ask us, and we'll be happy to answer them live for you. So I think that has been some great tips that you've given, sir, because a lot of times, especially first-time parents are not very aware of what is right, what is wrong, and they have 10 people giving them different advices. And they get so confused. So that's where it's very important for you to get the right kind of tips from the right expert. And that's how Dr. Holla, Senior Consultant Pediatrics, has been giving us some great tips today for newborn care and care of children during especially this winter time.
Thank you.
So yes, sir.
I've enjoyed this session.
It was lovely talking to you. And any takeaway message for parents?
Well, I'll just say that, babies are delicate, but at the same time, they can tolerate quite a few changes in temperature. You have to react according to the changes in temperature. So if it's cold, my advice to you is just stay warm, stay safe, stay indoors.
And to build up your child's immunity, keep breastfeeding your child.
Absolutely.
Thank you so much for joining in. All of you have a great day. Take care. Bye-bye.